My name is Dr. Kate Truitt. I'm a certified trainer as well as the Global Coordinator of Continuing Education for the Havening Techniques. Now I'd like to take a moment and talk to you about the coronavirus. Please don't skip ahead. I'm not going to provide more doomsday information. I know that there's already a million news sources that are providing ample information every second, and our phones are lighting up on a 3 to 5 minute basis with what's the next scary thing that's happening right now. One of the things I'm noticing is not present in the media is the conversations around mental health as well as emotional well-being. And the Havening techniques provide a really unique and special opportunity for self-healing in a time where we could probably all use a little more self-care. The Havening techniques are a newer modality for trauma reprocessing as well as autonomic nervous system regulation. They rely on neuroplasticity to create impactful change on how the brain is functioning. One of the greatest gifts of Havening is something called self-havening, which means that we actually hold in our hands the ability to do our own healing work. This is one of the few modalities that can work very successfully in a treatment space with clients and patients, but also transition easily to telehealth. So even as we look at the world right now, and I know many of my colleagues are deciding, do we move to telehealth? The colleagues that are trained in Havening have an ongoing ability to continue to do the reprocessing work that they've been doing with their patients in office. Self-havening has many opportunities for calming the brain and building in what we call resources as well as resilience. Resilience is something that says, I am going to be able to get through today and tomorrow, and there is an end in sight, and I have what it takes to continue to move forward. One of my favorite things about self-havening is that it's in our pocket and we can take it on the go. We don't need anything other than our hands. And one of the primary mechanisms is exactly that, simply rubbing your hands together. And I'm sure you've heard a million times right now, wash your hands. Well, guess what you're doing every time you're washing your hands? You're actually self-havening. So just now imagine taking that motion out into your day-to-day life. And by simply doing this act, your body and your brain are going to move into what's called a delta wave state. That's a state of calm relaxation or slow brain waves. When we're really excited, our brain goes like this very, very quickly. And in a delta wave state, our brain's moving like this. Delta also provides us with an increased experience of serotonin and GABA. Those are really lovely neurochemicals that our brain and our body love. Simply doing this act will start to calm our nervous system. If we move to another one, just imagine giving yourself a nice, warm, fuzzy hug. This will actually increase the experience of delta waves. And so the combination of these two self-havening experiences will help your brain and your body go, oh, okay, there's a possibility that things might be calmer. Now, havening involves many different protocols. Some are deeper level trauma processing, but the protocols for on the go, we have, again, the opportunity to apply for ourselves as well as for our loved ones. One of the simplest protocol I call CPR for the amygdala. The amygdala is our fear or survival brain. And CPR for the amygdala empowers us to say, hey brain, calm down, let's think about something else, and we don't need to spin that fear story. Right now there's a lot of health anxiety circulating. So health anxiety is a phenomenon where our brain says, I have a chronic illness or condition. And even the tiniest cough or hiccup can spiral our brain into a sense of panic or fear. Sometimes it's panic or fear for ourselves, or if we cough and we're at dinner with our family, it's say, did I just harm my family because I coughed? So by applying the self-havening touch and literally giving your brain a different job when you start to feel fearful, such as singing Old MacDonald or Itsy Bitsy Spider, or maybe playing a category game. Let's do something along the lines of A to Z and find a band or an artist for every letter of the alphabet. These little hacks will give your thinking brain a different job so that your amygdala, that fear brain, can't continue to build anticipatory fear stories, which then loop into our brain and start to feel like truth. And every cough becomes a death sentence. Now we're in trying times and it's important to stay healthy. It's also very important to keep tabs on our brain and our body and make sure that our emotional health and our overarching mental wellness is front and center as well. So while you wash your hands, take a moment and sing a song. Your brain and your body will thank you.